Okay, the next one's going to be cleaning and disinfecting of the treatment room, okay? So we're back in the sterilization. Ms. Gonzalez is going to show us where we can find our utility gloves, okay? She's already washed her hands, so now she's putting on the appropriate size utility gloves. If you have your own utility gloves, you can put those, you can use those. Okay. Okay, so now we're going back to finish up the treatment room, getting the room ready because we'll have our next patients coming in. So we've already taken all the barriers off, so now we come back here and we're going to get our cavi wipes. What we're going to use in our dental office is cavi wipes. We also have Birex. We showed you the video on that. What's important here is that you always want to have the lid closed. You don't want to leave the lid open because then it will dry up the towelettes that are in there. Always just take a second to close them. Okay, now she's going to go back and wipe any hard surface that can use the cavi wipes. So you want to make sure that before you use any product that you make sure to check that you can use it on the equipment and surfaces in your treatment room, okay? So she'll do all the hard surfaces, she'll do all the hoses, all the suctions. The last thing you're going to do is going to be the sink, because remember that's the dirtiest place, okay? You'll re-wipe all of the cords, and in our book it does say, you know, you're going to spray on and leave on for the manufacturer's recommended time, which in some cases is 10 minutes, okay? And we're going to be using the spray, wipe, spray, and then re-wipe, okay? You have to leave it on for 10 minutes to really make sure that it's doing its job, okay? How many cavi wipes do you use? Well, you use as many as necessary, but always make sure that you are using them wisely, okay? If it's dry, it's not doing its job, then it's not worth it, okay? The chairs in our dental units, you do not use cavi wipes, you do not use Birex, okay? Next we can do is the tube head, okay? The tube head, the exposure buttons, the handles, the little tray, anything like that that you may think that may have gotten splatter. Okay, so Ms. Gonzalez says anything that we may have touched when we were taking x-rays gets wiped down. Okay. The exposure button. And the last thing that we're going to do is make sure that we get the light switches on the view box, the amalgam cradle, the lead apron. The kind that we use here we don't use the cavi wipes on it. If it does get dirty, there is a certain type that we do use. So that is it for the completion of the dental unit.